Welcome. Today, we're diving deep into a rare and often debilitating condition known as autoimmune autonomic neuropathy, or AIN. This is a disease where your own immune system turns against parts of your nervous system that control essential, involuntary bodily functions. Join us as we explore its causes, effects, diagnosis, and what can be done to manage this complex disorder. The exact cause of autoimmune autonomic neuropathy is, in many cases, unknown. This means it is often idiopathic. However, AIN is believed to arise from an abnormal immune response. Sometimes this response can be triggered by a preceding viral or bacterial infection. In other instances, AIN can be associated with underlying autoimmune conditions like Sjogren's syndrome or systemic lupus erythematosus, or even certain cancers, suggesting a potential paraneoplastic cause. Essentially, the immune system mistakenly identifies components of the autonomic nervous system as foreign invaders and launches an attack. To understand AIN, we need to talk about the autonomic nervous system. This system is responsible for regulating things you don't consciously control, like heart rate, blood sugar, digestion, sweating, and bladder function. In AIN, the antibodies produced by the immune system target specific receptors and nerve fibers within this autonomic nervous system. This attack damages these nerves, disrupting their ability to transmit signals properly. The result is a wide range of functional impairments depending on which parts of the autonomic nervous system are most affected. Nerve conduction can be slowed or completely blocked, leading to a cascade of problems throughout the body. Autoimmune autonomic neuropathy is considered a rare disease. Precise epidemiological data is limited, but studies suggest that it affects a small percentage of the population. It can occur in both men and women, and while it can present at any age, it is more commonly diagnosed in adults. The rarity of the condition often leads to delayed or misdiagnosis, highlighting the importance of increasing awareness amongst both patients and healthcare professionals. The signs and symptoms of AIN are incredibly varied and can significantly impact a person's quality of life. Common symptoms include orthostatic hypotension, which is a sudden drop in blood pressure upon standing, leading to dizziness or fainting. Gastrointestinal problems like nausea, vomiting, constipation, or diarrhea are frequent. Bladder dysfunction can manifest as urinary retention or incontinence. Other symptoms might include excessive sweating, dry eyes and mouth, difficulty swallowing, erectile dysfunction in men, and pupil abnormalities affecting vision. Because the autonomic nervous system controls so many functions, the symptom list can be extensive and unique to each individual. Diagnosing AIN can be challenging due to the broad range of symptoms and its similarity to other conditions. The diagnostic process usually involves a combination of clinical evaluation, autonomic function testing, and blood tests. Autonomic function tests, such as tilt table testing to evaluate blood pressure regulation and sweat testing to assess sweat gland function, are crucial. Blood tests are used to look for specific autoantibodies known to target autonomic nerve components, such as ganglionic acetylcholine receptor antibodies, GAPCHR antibodies. In some cases, nerve biopsies may be performed to examine nerve tissue directly. A thorough medical history is essential to rule out other potential causes of autonomic dysfunction. While AIN is primarily classified as a single entity, the specific presentation and affected autonomic functions can vary significantly from patient to patient. Some individuals may experience predominantly cardiovascular symptoms, while others may have mainly gastrointestinal or urogenital issues. Understanding the specific pattern of autonomic dysfunction is crucial for tailoring the treatment approach. The treatment of autoimmune autonomic neuropathy focuses on managing symptoms and suppressing the autoimmune response. Symptomatic treatment may include medications to raise blood pressure, anti-dial or anti-constipation medications, and medications to help with bladder control. Immunosuppressive therapies, such as intravenous immunoglobulin of VIG, plasma exchange CPLX, and corticosteroids, are often used to reduce the activity of the immune system and prevent further nerve damage. In some cases, other immunosuppressant drugs like azathioprine or cyclophosphamide may be considered. Physical therapy and lifestyle modifications can also play a role in improving overall function and quality of life. Unfortunately, there is no known way to definitively prevent autoimmune autonomic neuropathy. Because the underlying cause is often unknown and potentially related to complex interactions between genetics, environmental factors, and immune system triggers, preventative measures are currently not available. However, maintaining a healthy lifestyle, managing underlying autoimmune conditions, and seeking prompt medical attention for potential infections may help support overall health and potentially reduce the risk of developing immune-mediated disorders. The prognosis of autoimmune autonomic neuropathy varies depending on the severity of the condition, the promptness of diagnosis, and the response to treatment. Some individuals may experience significant improvement with immunosuppressive therapies, while others may have a more chronic or relapsing course. Recent research is focused on identifying more specific autoantibodies and developing targeted therapies that can selectively suppress the autoimmune response without causing widespread immune suppression. Researchers are also exploring potential biomarkers that can help predict disease progression and treatment response. Continued research efforts offer hope for improved diagnostic and therapeutic strategies for individuals living with AN.